Today topic of discussion is muscular dystrophy. Muscular dystrophy include the heterogeneous group of inherited disorder or disease. So it is an heterogeneous group of inherited disorder or disease which are characterized by progressive degenerative muscle weakness, loss of muscle tissue, which ultimately affect the muscle strength and action. So what are the characteristics? Progressive degenerative muscle weakness, loss of muscle tissue, and affect muscle strength and action. This muscular dystrophy primarily involved in skeletal muscles, and then few organs may also get affected. So primarily affected skeletal muscles and few other organs also affected. So what are the causes? Causes of muscular dystrophy disorders. This muscular dystrophy is all due to the inheritance. It is because of inheritance of affected gene that leads to mutation of different genes or dysregulation of gene. Mutation of gene or dysregulation of gene like dystrophin gene, DUX4 gene, EMD gene, and LMNA gene. So what are the causes? It is due to inheritance of affected gene that leads to mutation of different genes. What are the genes? Genes like dystrophin gene, DUX4 gene, EMD gene, and LMNA gene. We see the inheritance of these affected genes. These four different kind of genes follow the pattern of sex-linked inheritance, autosomal recessive inheritance, or autosomal dominant inheritance. So what are the genes causes mutation? Dystrophin, DUX4, EMD, and LMNA genes. These genes affected following the pattern of sex-linked inheritance, autosomal recessive inheritance, or autosomal dominant inheritance. So first one, sex-linked inheritance. Duchenne muscular dystrophy, Becker muscular dystrophy, Emery diffuse dystrophy. So sex-linked inheritance, three type of muscular dystrophy: Duchenne muscular dystrophy, Becker muscular dystrophy, Emery diffuse dystrophy. Second one, autosomal recessive. We have limb-girdle muscular dystrophy is recessive when mutation on 15q chromosome. So first one is autosomal recessive limb-girdle muscular dystrophy, limb-girdle muscular dystrophy, congenital muscular dystrophy. Third one is autosomal dominant. In this one we have facioscapulohumeral muscular dystrophy, facioscapulohumeral muscular dystrophy, limb-girdle muscular dystrophy. This one mutation on 5q chromosome. Then oculopharyngeal muscular dystrophy. autosomal dominant, we have facioscapulohumeral muscular dystrophy, limb cridiale muscular dystrophy, oculopharyngeal muscular dystrophy. So first one is sex-linked inheritance, Duchenne muscular dystrophy. We have the mutation in dystrophin gene. We have mutation in dystrophin gene, that is DMT gene, which is located at EXP 21.2 position. So we have mutation in dystrophin gene, DMT gene, where it is located EXP 21.2 position. This is X-linked recessive disorder where dystrophin protein is totally absent, or it is in truncated form. In this disorder, there is muscle loss for 4 years. Here muscle loss for 4 years and mostly scoliosis. This one is the normal spine. This one is scoliosis. Now we see what muscles are affected in Duchenne muscular dystrophy. The muscles of hip, pelvic area, thigh, calves are affected, followed by shoulder, necks, arm, respiratory muscles and other area. Now moving forward towards mutation. We know this is X-linked mutation, and this mutation is found in P arm of chromosome at 21.2 position. And only things to remember here is that this dystrophy genes has got 79 exon. This dystrophy gene got 79 exon, and when we see here that among these 79 exon, there is deletion of exon from 45 to 55 exon, that leads to out of frame dystrophin transcript, which gives rise to truncated dystrophin protein, or even protein is absent sometimes, that eventually leads to DMT, that is Duchenne muscular dystrophy. So here this one is X-linked in mutation found in P arm of chromosome at 21.2 position. Here it have 79 exon, deletion of exon 45 to 55. So it leads to out of frame of dystrophin transcript. So can rise to truncate dystrophin protein. This one leads to Duchenne muscular dystrophy. In the present time, there have been experiments on this Duchenne muscular dystrophy with CRISPR technology by using exon framing, exon skipping and exon deleting. So here using experiment CRISPR technology by using exon framing, skipping and reduction. So second one is Wagner muscular dystrophy. This one also X-linked recessive disorder due to mutation in dystrophy gene that result progressive muscle degeneration and proximal muscle weakness. This condition is less common and less severe than DMD. What is DMD? Duchenne muscular dystrophy. So this one is X-linked recessive disorder, mutation in dystrophin gene. Then this condition is less common and less severe than Duchenne muscular dystrophy. What are the common symptoms? Arm weakness, difficult to walking, then hard heading out of chair, muscle pain or spasm, frequently fall. Other symptoms: cardiomyopathy, breathing problem and fatigue. Then this one is milder form of Duchenne muscular dystrophy. Milder form. In this muscular dystrophy, sunset of muscles are affected, handset of muscles are affected in case of this Duchenne muscular dystrophy, but to the lower extent, and there is deduction of 44 to 54 exon among 79. 44 to 55 exon among 79 deletion, and in that case we get misshapen or autoprotein, because this is the in-frame mutation which leads to transcription of that dystrophin protein, that is partially functional protein. So this one is the milder form, deletion of 45 to 54 exon among 79. Here we get misshapen or autoprotein because of this in-frame mutation, leads to transcription of this dystrophin protein, that is partially functional. Third type of muscular dystrophy, Emery-Dreifuss muscular dystrophy. Emery-Dreifuss muscular dystrophy, which is due to the mutation of EMD gene that make emerin protein. This one is excellent good recessive disorder whose gene is presented on X chromosome at Q28 position, but there are other genes also that contribute to EMD, that are LMNA gene, which makes LMNA RC protein. Second one is XYNE1R2 that makes nexprin, which makes nexprin protein. It must be noted here, that is emerin protein is expressed in cardiac and skeletal muscles. So both organ muscles will be affected by this disorder. So in this case, EMD disorder, which included cardiac muscles also. So second one is X1NE1R2 that make nexprin protein. This one expressed in cardiac and skeletal muscles. Both organs will be affected by this disorder, included cardiac muscles also. Then fourth type of muscular dystrophy, limb girdle muscular dystrophy. Limb limb-girdle muscular dystrophy, which has both recessive and dominant pattern. Recessive and dominant pattern. The gene affected in this disorder, DDID gene. Which genes affected from this disorder? DDID gene at 5q31 position, which shows autosomal dominant inheritance. Then where the CAPN3 gene at 15q 15.1 position, which shows autosomal recessive inheritance. In this disorder, the calpain 3 protein is affected. That's why it also termed as kalpanopathy. Here calpain 3 protein affected, so it is also called as kalpanopathy. Then there is the third gene mutation which leads to limb-girdle muscular dystrophy, which is SGCA gene at 13q12 position, that make gamma sarcoglycan protein. And if we see that muscles are affected in this disorder, hip and shoulder are affected. So limb-girdle muscular dystrophy, this one both recessive and dominant. First gene affected, DDID gene at 15q31 position. Second gene, calpain 3 protein 15q 15.1 position. So it causing disease name is called as kalpanopathy. Third gene, SGCA gene 13q12 position, make gamma sarcoglycan protein. So these are the things will affected hips and shoulder. So fifth disorder, fascioscapulohumeral muscular dystrophy. Fascioscapulohumeral muscular dystrophy, which is due to mutation of several genes like ANT1, FRG1 or 2, TUX4C. But the mutation of TUX4C is most common. Fascioscapulohumeral muscular dystrophy, several gene mutation will happen. ANT1, FRG1 or 2, TUX4C. The TUX4C is the most common. It affected face, shoulder and upper arms. Moreover, if we see the genetic mechanism of DUX4C gene, this disorder is all due to dysregulation of X4 gene. We see this DUX4 gene is mostly expressed during initial stage of embryonic development. But then in later stage it remained expressed in all developmental stage except in testes. But in this disorder, this dysregulation at 4q35 chromosome position due to epigenetic changes turn the gene on. Remember, the represent or inactive form of gene is normal, but the dysregulation turn the gene on which is abnormal, and this is leads to somatic expression of DUX4 gene, that in turn leads to DNA contraction in the form of D4Z4 contraction. This contraction deletes the D4Z4 repeat arrays, which is lethal for the cell because this D4Z4 repeat array acts as transcriptional silencer within the cell, and when these repeat arrays are deleted, the cell death is inevitable, and even the DUX4 protein is toxic for cells that leads to FSHD disorder, that means facioscapulohumeral muscular dystrophy. So these are the major muscular dystrophies explained. DUX4C gene deregulation of X4 gene, then DUX4 gene mostly expressed during initial stage, later stage expressed in all development except testis, then disorder dysregulation at 4q35 chromosome position, then inactivation of gene dysregulation turn the gene abnormal, leads to somatic expression of DUX4 gene, then leads to DNA contraction, D4Z4 contraction. So the DUX4 protein toxic to cell leads to facioscapulohumeral muscular dystrophy. Thanks for watching.